Casa de Esperanza means House of Hope, and it's an organization based out of Minnesota that works at the national level, providing training and technical assistance both nationally and internationally, as well as engaging in policy advocacy and research. But first and foremost, Casa de Esperanza is a Latino community-based organization rooted in the reality of communities and helping mobilize communities to end domestic violence. And it started in 1982, way before the passage of VAWA. And I think it's wonderful that we gather to see how far we've come and what an important resource and tool the Violence Against Women Act is, the passage of that act. And in particular, I'd like to highlight one provision that is a tremendous help and resource to a very vulnerable population, and that is immigrant women. Prior to the passage of VAWA, advocates, service providers saw a very troubling pattern, which was that immigrant women married to a spouse who was a legal permanent resident or a U.S. citizen and who found themselves in a situation of domestic violence people would become aware of that situation, but that woman would be very afraid to seek help because her own status had never been adjusted. Even though her spouse could have adjusted her immigration status, it became a source of power and control and to create a tremendous situation of vulnerability and exploitation. And so that woman was afraid to call the police for fear that she'd be deported and would lose contact with her children. She was afraid to leave because without legalized status, she could not gain employment, and so was economically very dependent. And so the Violence Against Women Act was an important lifeline that created an important resource, which is the opportunity for a victim of domestic violence to self-petition when she is married to an abuser who's a citizen or permanent resident. And also other important provisions are the U visa for victims of violent crime and the T visa for victims of trafficking. So we've made great inroads, but we have a lot more work to do. One of the critical resources is legal services for victims. And VAWA has played a key role in providing the legal services for victims grants, and yet about 70% of women still are without legal representation. And so we need a lot more effort to really be able to help women be able to enforce those rights. Without that kind of assistance, they're only as valuable as the paper they're written on. And so we need to continue to advocate to make this much more meaningful and to be able to access that resource. And also, as we know, domestic violence, it transcends race, class, ethnicity, geographic location, and yet it's not the same solution for every community. One size does not fit all. And so we continue to find ways and need to find ways to mobilize communities, to develop programs and outreach and resources that reach communities where they can be found and that help overcome barriers. We see many women that face barriers to accessing services. And so I really want to commend all those who've worked so hard in the last reauthorization of VAWA that created a special new grants program called Grants to Enhance Culturally and Linguistically Specific Services. And it's creating new opportunities for innovation at the community level. And briefly, I want to share with you just a story. Just last week, I was meeting with a national Latino organization working on health issues to try and see how we could collaborate around domestic violence. And they told me, we realized we need to do this because we had funding to do a program with promotoras de salud, which are health promoters in the community, around diabetes. So they trained these promotoras on diabetes. These were community leaders in the Latino community. And as these women went out over the course of a couple months doing this work, nearly 100% of them came back and said, women are asking us for help in addressing domestic violence. We're going there to talk about diabetes, but once we establish a relationship, they feel some safety, some trust, they see that we're a resource, they're asking us for help on them, and we don't know what to do. And so they said, well, our funding was for diabetes, but they realized they needed to do something to address this. And so I think we need to realize that we can't look at these issues in little silos. People's lives are complex, they overlap, and we need to figure out ways to comprehensively address these myriad of issues and put the tools and resources in the hands of communities. And that's something that at Casa Esperanza, with our Líderes program, our youth peer educators, are mobilizing different, what we call puentes a la comunidad, bridges to the community, different community leaders who are not trained necessarily in DVSA, but are willing to be those bridges in the community. And so all of you are bridges in the community, and I really thank you so much for all your work. And although we've come a long way, we have a long ways to go, but I'm very confident that we'll continue to make great inroads in ending domestic violence. Thank you.